in a Zoom meeting the other day, and I could tell somebody was really struggling, and I could see his eyes just getting bigger. And I'm texting, breathe, right? This isn't, we can't address it right now, but clearly this is out of character. So when we see that, it's helping each other, not, because we're still human beings, we're going to react, but it's okay. Just breathe. Let's all talk about it. Let's figure it out, and let's move forward. And I think as leaders, we have to always have our ears open, because it's really easy to go, yeah, right? Yep, I'll get to that, blah, blah, blah. But if you don't slow down long enough to really listen to what your staff are saying, I don't want them to get to that point. But I also want them to feel like they can grab me, professionally and all that.
Absolutely.
And say, you're not listening. I need you to stop, and I need you to listen. And I think if you can create that type of culture, then people will respond to that. I really do.
Welcome to the Brainwaves podcast by Opus, where we sit down with industry leaders to unpack their journeys, explore key challenges, and talk about how they're shaping the future of behavioral health and healthcare technology. I'm your host, Sean Rickenbacker, and today we're diving into a topic that truly impacts every single behavioral health provider out there: clinician well-being, burnout prevention, and fostering a healthier workplace culture. Our guest today is Kimberly Cox, the Chief of Clinical Services at Pathways Recovery Centers, an organization dedicated to providing comprehensive addiction and mental health treatment across multiple states. With more than 2 decades of leadership experience in behavioral health, Kimberly has guided clinical teams through complex challenges, launched her own successful mental health counseling practice, and led facilities to remarkable outcomes, including a perfect 100% compliance audit from the state. But Kimberly isn't just passionate about operational excellence. She's equally devoted to advocating for the well-being and resilience of the clinicians she leads. At Pathways, she's become known for her thoughtful, compassionate approach to leadership, championing initiatives to tackle burnout head-on, and emphasizing that supporting caregivers is just as essential as caring for patients. Kimberly, thanks again for joining me here today on the podcast. Kimberly and I spoke last week when she spoke at Pathways to Innovation, so I'd love to jump right in. Let's kick things off. Let's hear your story in your own words.
Okay. My story is like how I got here.
What kind of got you into the behavioral health world? Was it something you studied or something you just got into eventually?
Well, to be perfectly honest, so back when I was making those decisions in high school, like what did I want to study as I move forward? And this is going to age me quite a bit. Back then, soap operas were a big thing, and I was very much into Days of Our Lives. And one of the characters was a psychiatrist. And so I don't know. I picked that thinking, oh, okay, that looks good. Not a lot of direction, no counselors, guiding me. That's just kind of how I threw that dart, and that's where it landed. And when I was in college, I quickly realized that going for a medical degree and all of that chemistry was not my thing. That I was completely unhappy, and realized one day, oh, wait a minute, I have a choice here. I don't have to keep suffering. But I also knew I was not a big fan of being in school. I didn't like school. I liked the social aspect, but I didn't like school itself. So I went to the counselors and I asked them, what can I do and still be out of here in 4 years? They said, psychology. I said, fine, sign me up. So if people were looking for this passion and this big thing, no, I didn't have that. But what I did notice was it came really easy to me. And I've heard somewhere in my career that is key, that a lot of the people in our profession who do well, not to say, like I'm anything, but that's just a natural fit for them. And that's probably true in all careers. Like you have to have some sort of passion for it once you get in there, because you really don't know until you get in there. And then I had stayed at home with my kids, went back and got my master's as they got older, and just kind of fell into things from there, and just have been really blessed throughout my career to be given lots of opportunities and guidance and mentors. And here I am.
That's awesome. I think as well, like those decisions you may feel like it was made on a whim, but obviously you were meant to be in the behavioral health space. You know, it stuck with it, and it seems like you've had great success, especially over your career here and as you're in leadership with Pathways. So you mentioned that you had your kids, and that was something that you were balancing. Can you tell me more about, I guess, balancing that work with raising your family?
That was tough. Sometimes I think, gosh, how did I do any of that? I don't know that I slept a lot. Of course, I was younger. you know, I don't know if I could do all of those things now. I had three kids that were very active in sports. I commuted roughly an hour and 15 minutes one way. Yeah.
Mhm.
But we loved where we were raising them and we didn't want to leave. We didn't want to uproot them. So I just did. I did the things. I had supervisors who were very flexible. Like if they had games, then I could leave and just kind of flex out my work. And that was before the era of being able to work from home and do those things. But I just did, or I stayed late, or I worked on the weekends. I was not the epitome of work-life balance on
Fair.
any level. And then on top of that, I went back and got my MBA. So I really don't think I slept for that 2 years. It's just kind of a blur. I had a very supportive husband, and again, my work, they were very supportive, and I just kept going. I was also very fortunate with the people that I worked with early in my career that they sent me to a lot of different trainings on leadership. Even before I was in leadership, they were sending me to trainings, having me sit in on different panels and just different things for not only helping with the deliverables that we had to do for different auditing agencies, but also in developing culture and writing policy, things of that nature. I got asked to be a member of the Behavioral Health Board of Licensure in Oklahoma, which at the time was something different, broken out by our licenses, and then it became a composite board. But I sat on that, gosh, I don't know, 15 to 20 years, somewhere in there,
Yeah.
and learned how to write laws and all kinds of things. So I just was blessed. Like I said, I got exposed to so many different opportunities and things in my career that just really kind of made it a natural fit and trajectory to get to where I am with Pathways.
Absolutely. It sounds like you mentioned, you feel like you have been given a lot of these great opportunities, those leadership trainings and uh, a lot of great opportunities to grow in your career. As far as like work-life balance, I know you said you weren't the epitome of it. Is
I
there
am
any,
pot kettle.
yep. Is there any advice you'd give to young parents? Like if you went back and spoke to yourself when you were starting off, what advice would you give yourself in order to help yourself through it?
Gosh, when I was younger, I would tell myself, take the time. And not that these things weren't told to me, but I think you learn backwards. You get to that point, you look back and you go, oh, yeah, they told me this was going to go by really fast. And it does. And just to hold on to every moment, take the time off. If that's what you have to do to go to that game, take the time off. That's what that time off is there for. Invest in your kids, invest in your relationships, work your 40 and stop, right? There are times where there's major projects that have to get done, and okay, so give a little bit more. But one mentor told me, and she was absolutely right. She said, you could work 50, 60, 70, 80 hours a week, but eventually you're going to get sick. And then all that work that you did is going to stall, and then you're going to have to start back over, figure out where you were at. So really, how much did you get done? How far ahead did you get, and at what cost? Right? And I saw that play out because she insisted that we all take our lunch breaks, because none of us were. We were just going from the time we hit the door. And I noticed that one of my directors underneath me hadn't taken her lunch break. And I was like, you have to take your lunch break. And she just broke down sobbing and got really mad at me because she had all of these things to do. I was like, okay, I want you to take your lunch break anyway, and then we're going to talk. And then we're going to
Yep.
take some time off. That's obviously we're creating all of the stress. We're not getting enough sleep. We're not taking care of ourselves. So I think that's important in a leader to, recognize when you're pot kettle. Like my staff now, they'll text me if I'm answering an email when I'm supposed to be off. They're like, "You're supposed to be off," because I do that to them. I'm like, "What are you doing? I might be sending you an email, but you're not to be answering me till you return from work or from your vacation or wherever, whatever the case may be. Take the time off to go to the doctor, to be preventative. Take the time off to go see the school play. If, your child is sick, stay home. It's okay. It's going to be okay. We will be fine. I want you to take care of your children. Those are things weren't communicated to me necessarily, but in my mind, I didn't have those choices. But I don't think anybody said that to me, but that's just how I felt. And so I try to make it really clear to my staff that you have that choice. And so for the younger generation or people coming up in the career, I try to remind them, no, this is your job and it is important. This is not your life.
I love that. I love that. I think, not to interject my own story in here, my wife and I, we've got a young daughter. She's a little bit over a year. And so a lot of
Congrats.
this advice is, thank you. She is a ray of joy in our lives, etc. So she's great. But I love that advice, especially for somebody who's has recently started their family, being able to navigate a career. You mentioned different ways that you help people to report to you and are adjacent to you at Pathways. Is there anything that Pathways does institutionally in order to try to cultivate a culture where work-life balance is able to be maintained?
I think from the top down, we are constantly reiterating that you've got to take your time off. You've got, and it's not so much, I think I would hope all organizations do that. You've got to take your time off. You've got to take your sick leave. If you're sick, it's okay. We don't expect, because I've got one person in particular I'm thinking of. She'll be sick. Her child might be sick, and I'm still getting emails like even this year, like they were really sick with flu type A, then type B, COVID. And I'm like, stop. You've got to put that computer down. You have got to rest, right? I don't want to see anymore. It is okay. Your job is not in jeopardy because you're sick. And I think just reiterating that over and over. And then, like I said, I'm not the best at modeling that, but I do try. And when I noticed that, like one of my staff recently, we were talking about PTO and I knew they had a lot. And I'm like, well, when is your anniversary date? When does it come up? And they're like, well, it's coming up. I'm not going to be able to take all of this time. And I'm like, well, you get to roll a week. What does that leave you? And they still had like 2 or 3 weeks. And I was like, well, if you've got to take it every other week until you get to roll it over, then do that. And then let's concentrate on taking it next year and spreading it out. I don't want somebody to feel like just because they didn't manage it through the year, that was all on them. I know the different circumstances and the whys of why this person wouldn't have done it, but I don't want you to just give it up either. Go take it. Go take it. Feel supported. Be supported. You have towel work to do.
Yep.
I know because she told me, go do it, go get it done, right? Do the things. And then next year, let's plan better. And that's my job to help you do that. You know, I'm not good at it either, but we're going to work together. And I try to be pretty transparent. I'm not the end all be all. I know my pieces because they're my pieces. But if this person had been exposed to these different things, they'd have the same pieces. So I have my pieces, you have your pieces. We have to work together to make them fit. But
Absolutely.
that doesn't mean because I hold the title that I'm just woo. woo. And, no, I'm just a person like anybody else. I've been in it longer. We won't talk about how long. And I've had these experiences. And so, I can recognize things, but that's only because I was taught myself. So I try really, because I'm on the back end, right? I want to really help people to understand that there are choices and there's so much we can do in our career. It's not just what we thought it was or what it was even when I started. So find your passion. Find your passion. I will help you find it. If it's not with us, I'm not going to hold you back. I welcome, expand your career. You can go somewhere else. It's okay. It's okay. I don't want you to. I have
Yeah,
one
yeah, of
person
course.
right now who's in one role wanting to go back to school for something completely different, and I'm like, well, how can I use this though? How can we keep you? She's phenomenal, but this is a passion, and I just joke with her and I tell her it's okay. I'm going to let you go when the time comes, but I hope it does.
Totally
That's
get
my
that.
selfishness. Wait till I retire and then you can do what you want, right? We try to laugh and be silly. We're all in this together and we're all in
Absolutely.
it for one thing, and that's to help our clients.
Hmm.
Because if our clients don't get well, they either go to prison, they die, or they get well. That's it. And everybody's affected by addiction at this point. Unless you're living in a cave somewhere, I don't know who's not affected on one side of it or the other.
I love what you said about it always being about your patients, making it, if you're not doing it for you, you're doing it for your patients kind of thing. And I also love that you said essentially, you keep saying that you're not the epitome of work-life balance, but you keep your coworkers, your direct reports honest, and it sounds like they keep you honest about it too. It's all about that trust that you've built.
Yeah.
If you were to speak with somebody who had their recovery treatment center organization or a different type of organization where work life balance wasn't institutionalized and maybe people suffer from a lot of burnout, what kind of advice would you give if you were to start that sort of program from the ground up?
So I would take the advice of a mentor that I had a long time ago. I would not, I know that the standard answer is send out surveys, blah, 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 but those are pretty impersonal. They just are. I think it would be better as she did, and I saw her do when she took over an executive role. She went and met with everybody one by one. So everyone in the company. And I mean, it took her a couple of months and she took notes. And this was back before Zoom existed. So she had to go to everybody's office to find out, what do you really think? How can we help you? How can we better support you? What do you think about the philosophy, about the treatment that we're doing? Where do you think the gaps are? What do you think that we're doing well? And she honestly wanted to know, and they knew that. So, and they appreciated that she took the time to meet with every single person, and then not only do that, but start implementing things and kept that line of communication open and revisited things. For example, I meet with my team once a week as a group and once a week individually with each of them. And so, thank goodness we have the AI and it takes all the notes so you can really focus on what you're talking about. But it lists all of the action items, right? So I'm always going back to the previous notes so that we don't forget anything. But even then, you can still forget something. So you have to go back even farther and kind of read through, did we drop anything? And I feel like that's my responsibility to keep us on track. That's not their responsibility. It's my responsibility to keep us moving forward. They'll bring it up if they think of something, but just that really working as a team. So always keeping that line of communication open. And then like if you have multiple organizations like we do, we have with the clinical team at this point. So the executive director meets with the COO. So he meets with them individually once a week and as a team. So all of the executive directors and the COO are on this call. Me, I do that with the clinical directors. And then once a quarter, we get every clinician on a Zoom call meeting, and one facility poses the questions on like, how do you do this? Like, how do you handle peer review calls? Because that's a big one. Nobody likes to do this. And nobody likes to feel like, I don't know how to do this. I'm doing it wrong. How are you doing it? So, like, pushing all of those barriers away. We're one organization. We might be in three different states, but we're still one organization and we have all of these great minds, right? Let's all get together and share our information and work together, because ultimately our passion and why we do this is to get people well and hopefully one day work ourselves out of a job. So as much as the introvert that I am, and I would just rather focus on my spreadsheets and not get out there, and I get in trouble for that. People will call me out on that. They're like, you haven't gotten up from your desk. You haven't come and mingled. You haven't talked to us. Clients will call me out on that. And I'm like, I'm an introvert. I can play an extrovert, but I'd rather just sit here at my computer and never talk to anybody. So, getting out there and really talking to people and creating that transparency, where I do really feel like everybody's got my phone number, and if they don't, it's on my email. So anyone could call me at any time, and people have, and even with concerns. And so I address those concerns, but nobody knows somebody called me, right? It's because they're not calling for a gotcha. They're calling because they're concerned about the treatment or the culture or things going on with clients, and they don't feel like they're being heard. And I'll circle back to something that just popped into my brain, a memory from when I was in sixth grade. And I don't remember doing this, but it always stuck with me that my mom had told me that this is what it's like for people who are under you. So I was in sixth grade. They had changed the teachers. I was in a private school. They had brought in nuns from the Philippines, and nothing against nuns from the Philippines, but I couldn't understand. English was not their first language, and we couldn't understand. And my class was a class of entitled brats. Like, we were all like, when you see it on TV and things are going through the air, and so, that's what it was like. It was insanity, and I wasn't learning anything. And as much as I'm in school and I have all these degrees, I get it. And I've even taught at the university level, but I still, something crazy in me kept going to my mom saying, I need you to change. I need to go to a different school. I'm not learning anything. And she said that one day I just kind of grabbed her and said, Mom, you're not listening to me. And she said it just stopped her in her tracks. And I think as leaders, we have to always have our ears open, because it's really easy to go, yeah, 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 yeah. Right. Yep. I'll get to that, blah, blah, blah. But if you don't slow down long enough to really listen to what your staff are saying, I don't want them to get to that point. But I also want them to feel like they can grab me, professionally and all that, and say,
Absolutely.
you're not listening. I need you to stop and I need you to listen. And I think if you can create that type of culture, then people will respond to that. I really do.
I love that. It sounds like you've cultivated this culture of trust that anybody can speak to you about anything.
I
They
hope
trust you
so.
to do that.
I hope so. If
Awesome.
they're listening and I didn't, give me a call because
You're like, you
I
have my
want
cell
that
phone
to
number. Call
be.
me right now.
Yes. Shoot me an email. I'll call you, because I want that. I want it to be that way. And I also think that in all of that, you also, as a leader, have to have that structure in place, and you have to have accountability in place, right? Because as often, and all of the different places that I've worked and had leadership roles, there's nothing worse than somebody is burnt out, or just say they're burnt out, and then they're not doing a good job. And everybody else notices, and they know you notice, and they know you're not doing anything about it. You have to, as a leader, be able to do those uncomfortable things. So I think that also fosters that trust as well. Not that you're going in there looking and but you have to do that part of the job. It's not the fun part of the job. If it's the fun part of the job, I would say you need You need to, you're the one that needs to leave, right? But you do have to do it. It's important. It's important.
Yeah, that makes total sense. So, Kimberly, speaking of burnout, what do you look for in order to identify burnout and help your employees before they start to feel?
Sure. So, being in psychology, right, and being a clinician, I don't mean to, but I naturally you can see it and you can hear it in the way people are holding themselves, the way they're talking to other people. If you're seeing them roll their eyes, sigh, they're like this. Like, I mean, that body language is a big thing. And it's taking the time to just say, hey, what's going on? How can I help you? How can I support you? If they're snapping, you're just asking them, hey, did somebody change the coffee filter? Oh my gosh, then, it's time to address that. Have sometimes I'll just get an email from one staff member in particular, and she'll just let me know I'm struggling. That's what, and so then I'm calling, what can I do? How can I help? Tell me what's going on. What is the situation that is just pushing your buttons? I would have another clinician who would email me, and he, we had a pool between our buildings, and he would say, it's time for you to come over to this side of the pond. And then other times he would tell me, don't come, stay on your side.
Yeah.
Okay. So you have to be willing to just go sit down and say, hey, I notice something's not quite right. I will do that with our COO. We basically kind of work like this. Like, he tells me his job is to find the money to do what I want to do.
Hmm.
I'm like, okay. But, I'll tell him and he'll tell me, hey, something isn't quite right. We were in a Zoom meeting the other day and I could tell somebody was really struggling, and I could see his eyes just getting bigger, bigger. And I'm texting, breathe, breathe, right? We can't address it right now, but clearly this is out of character. So when we see that, it's helping each other, not, because we're still human beings, we're going to react, but it's okay. Just breathe. Let's all talk about it. Let's figure it out and let's move forward. I mean, I don't know. I know that doesn't happen at every organization. I've had it a couple of times, and I do not want, I have no interest in giving it up
Yep.
at Pathways, because I really feel like, at least from my perspective, that trust is there, those relationships have been built, and we're okay with that transparency. I'm okay with being told, hey, are you sure about that? I got an email about that. I sent something out yesterday, and I got an email from one person and another person. I was on the phone with a meeting, and they're like, are you sure? Are you sure that's correct? And I'm like, you know what? Maybe it's not. I researched it, but let me dive a little bit deeper, and if I need to change some things, I will. No big deal, because I don't have all the answers. And I think that also helps with burnout, because if you go to a place where you feel like you can't even speak freely, how can you not end up burning out? I've been in that. I've been at a place where, I won't go into the details of the whys, but basically, we weren't allowed to leave our offices. We had to be quiet all day. So we were all, behind our doors. And we had this whole office of people, but we couldn't interact. We weren't allowed.
You're
I didn't stay there
alone,
forever.
but there, right? You're alone, but in an office.
Yes. I mean, it was very isolating. And there was one person who was very not nice to their staff, and they knew it, the supervisors, but nothing was ever done. So I think you can learn just as much from a not great environment, and you can get up and go. There's so many things out there. But you can learn, this is not how I want to be when I reach that leadership position. And I did. I would watch those things and be like, I don't want to be that, because I didn't like it. Yeah.
It's the same with a good example, all the mentors you've given us, and bad examples you can learn from as well.
Exactly. And I burnt
Yeah.
out and I left.
Yeah. And
Otherwise, I would have stayed.
you lose good people because you cultivate a culture where there's burnout. And it sounds like a lot of it's still the trust. Your coworkers trust you and they're willing to bring up, like, hey, I am struggling, come to my side of the pond, that sort of thing, in order to kind of have those maybe some tough conversations. I think that's super awesome. The one thing I'm curious about, I did hear that you had a 100% compliance audit.
We
That's
did.
that's an awesome feat.
It
How
is.
do you accomplish something like that and avoid burnout at the same time? I know that high standards, but
Right.
how do you get there while maintaining that culture that you've cultivated?
Well, I don't know. I knew that question was coming, and I'm like, to this, I don't know. We just we worked really well as a team. So my job as a clinical director, one of your jobs is to audit charts to make sure everybody's dotting their I's, crossing their T's, understands when things have to be done and that they get them done. So and my executive director before the first one, and then she had moved on to better things and we got a second one. But I can remember her saying, "You've made this paint by numbers." It would make her crazy. And I'm like, yeah, but it's got to get done.
Mhm.
And a clinician does not care that the state of Oklahoma, because that's where I was clinical director at Country Road when I got this, that the state of Oklahoma requires, for example, a treatment plan by day 7. They don't care.
Yep.
That's I'm here to help this client. Like, I'm going to make a treatment plan, but if all I'm ever doing, I can hear them. If all I'm ever doing is paperwork, when do I get to work with the client? If
Mhm.
all I'm ever doing is these deadlines and trying to get things right for the insurance and this, that, and the other, how am I ever going to work with the client? And that's a valid point. That's not what they're there for. That is certainly not what the client is there for. Like, oh, we got to do this treatment plan. Oh, what? I just wanted to talk to you about how I'm feeling. That's all that is. So I created a system where I took all of that think out of it. So there were a lot of trial and errors. By the time I moved up into this position, every week I was constantly auditing every chart. And then I would send them basically a to-do list at the beginning of the week or at the end of the week. It might be Friday night, Monday morning, whichever. On clients 1 through 5, you've got to have a concurrent review ready and treatment plans by this day, right? So I need you to see client AB this day, CD this day, and E this day. And then the rest of them don't have anything due. You need to see them, but you can figure out when you're going to see them. So there was some, I didn't dictate everything, but I had to dictate timelines. Yeah, I got to have this, right? And then it was always, I've got to have it by this time or the day before. And if something's going on, you got to let me know as soon as possible so I can figure it out. Either I got to pull you out of a group or I've got to shift something around so that you can accomplish that. Even if that means I got to go in there, which I promise you, I avoided it at all costs because I want to stay at my computer, right? But I
Yep.
would go in and I would do a group every once in a while if that's what was needed. I would carry a caseload every once in a while if that's what was needed. But that was very rare because clinical director really doesn't have time to do all of that. Their time is spent on that operational side more than anything. And then taking their feedback because my concern was, are you going to feel like I'm micromanaging you if I do this? And the feedback was, no, I don't want to have to do that myself. So that's fine. Just tell me. Right. And so then, if things weren't done and I wasn't hearing from them, then I would have to go and ask them, hey, where is this? Because I got to get it done. And sometimes I'd be like, if I've got to put my hands on your hands and we get this, we're going to get tight.
Yep.
Right.
Yep.
So a lot of joking around, but helping them understand this is why we're doing this because ultimately we have to do this because if we're not in compliance, they can shut our doors. And then who are we going to help? Right. And so, I would do that for the whole chart. So whether it was medical, techs, PRSS, clinician, whoever it was, I always knew what was going on. And that's, I don't know, somehow in doing that, we did that. And I realized that's because I've been through a bazillion audits in my career. So I wouldn't even say that it was so much me. I did my piece, but they all had to do their piece. And they are much more than me. And they got it done from residential all the way to outpatient, from the medical team, TAs, RSSs, case managers, clinicians. They got it done. They're just a phenomenal team. They really are. I cannot take credit. I did my piece of it, but their piece is so much bigger, and they did it.
That's
And
awesome.
I don't know. We got 100.
Yeah.
I was just as
It's
shocked as you.
it sounds like you built these awesome systems and those clear lines of communication so that if anybody needed your help, you were always there to assist them. It sounds like, honestly, Kimberly, you've been an awesome leader for your team, and I imagine they are so grateful for you.
I
I
don't know.
totally get that. I want to be mindful of your time. I know we're a little bit over, so I did just want to ask one question a little bit different from everything else, but do you have any book recommendations for anybody
Book
listening?
recommendations. So I am not a reader. I wasn't even in school. Hopefully they don't take my degrees back. I am not a reader. I will tell you the one book I read, and you talked about self care. So I get up in the morning and I try to spend an hour just focused on this one thing, and I set aside roughly an hour at night to do the same. And I read my Bible and I pray, and that is my main self care, and that is the only book that I read. And I'm not like trying to because I know I can hear it, but that legit, that is what I read, and I try to live that every day. Am I perfect at it? I'm sure. I joke at work that there's a dartboard at every facility with my face on it. And there are holes in that picture, right? But I try, I try to treat others the way that I want to be treated. I try to, when I know it, admit when I'm wrong. I will apologize. I've had my days where, like you said, how do you know that somebody needs a break? Well, I had, who's now our chief of admissions, he had come to me to ask me something, and I was desperately trying to get those to-do lists done. It's Friday. I want to go home. I'm tired.
Mhm.
Looked up at him and I'm like, can you figure that out on your own? Like wild eyes and everything. And he's like, yes. So then I'm stubborn like anybody else. I waited and waited and it just kept gnawing at me. And so at some point on my way home, I call him. I'm just, I am so sorry. He's like, what are you talking about? And I'm like, no, 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 no. I know I was ugly. Right. So, realizing that about yourself. Um, but yeah, that's the one book I read is the Bible.
And I think for anybody religious or non-religious, there's obviously some good points, like you said, treat others the way you want to be
Yeah,
treated, and really think about how you can love your neighbor. Not to pull
exactly.
directly from it, but that's
Exactly.
awesome.
It's true. I'm nobody's judge, you know. I'm just trying to do the best I can with this life I've been given. I
Perfect.
don't know what else to do with it.
Absolutely. Well, thanks again, Kimberly,
Well,
for spending this time with me. It was a great conversation. I got to learn a lot of great things for a career standpoint and leadership standpoint. So I'm sure our listeners will love your insights as well. But
I hope
thanks
so.
again for your time.
You're welcome.